Hi guys, today we are going to learn about pharmacology of Alzheimer's disease. Alzheimer's disease is nothing but it is a type of brain disorder. Particularly, it is a degenerative brain disorder and it causes a progressive decline in memory, thinking, learning and organizing skills. And increasing age is the greatest risk factor for Alzheimer's disease and it is described by Alois Alzheimer. It eventually affects a person's ability to carry out daily activities. And the most common cause of Alzheimer's disease is dementia. Depression and anxiety is the most common symptom of the Alzheimer's disease, and patients eventually reach a failure to thrive, which results in death. Failure to thrive is nothing but children are below ideal weight and the child is unnourished and they are unable to receive and process enough calories. And there is no cure for this disease. We can only prevent the symptoms of the Alzheimer's disease. And the early signs of the disease include difficulty in remembering the recent events or conversations. Now we are going to see about symptoms of Alzheimer's disease, and it is subdivided into three categories. They are early signs, middle stage symptoms and later symptoms. People with early signs will have memory loss and forgetting problems. That is, they will forget the places where they usually visit. And people in the middle stage, they will face increasing confusion and disorientation problems. And people will have a false belief like they are being followed by someone or believing their spouse is being unfaithful. And under the later symptoms, people will face weight loss, difficulty in changing position problems, and they'll gradually lose the communication with the other people. And some of the other symptoms are headache, dizziness, speech impairment, memory decline, trouble in sleeping, apathy, olfactory disturbance, and orientation. Next, we are going to see about stages of Alzheimer's disease. There are four stages of Alzheimer's disease. They are mild cognitive impairment, mild Alzheimer's, moderate Alzheimer's, and severe Alzheimer's. Under mild cognitive impairment, it is the early stage of Alzheimer's disease, and the symptoms are not severe as much. And people will have mild changes in memory and thinking. And under mild Alzheimer's disease, patients face memory loss problems. That is, they'll usually forget the recent events which has happened in their life. And they'll face some trouble in remembering the newly learned information. And they'll face difficulties in problem solving, judgments, and solving the complex task. And people will have the changes in personality, and this causes irritation to them, and they'll face some trouble in organizing and expressing their thoughts. And under moderate Alzheimer's, people grow more confused and forgetful. They show increasingly poor judgment and deepening confusion, and they forget details of personal history, that is their address, mobile number, or where they attended the school, and they repeat their favorite stories to fulfill their gaps in memory, and they need help for daily activities. And under the severe Alzheimer's, and it is the later stage of Alzheimer's disease, and patient lost their ability to communicate, and they can occasionally say the words or phrases, and they require daily assistance for personal care. And now we are going to see about how Alzheimer's disease occurs. It is caused by formation of abnormal deposits of protein in the brain, which is called as plaques and tangles. Plaques are made of two key proteins, that is amyloid and tau. Amyloid and tau are usually present in the normal people, but in Alzheimer's patient it functions abnormally. And amyloid forms plaques outside the cells and tau forms inside the cells. Plaque and tangle change the nerve cells causing to die, and this leads to brain to shrink. and this causes some trouble to form the new memories in hippocampus, which is the part of. Next, we are going to see about drugs for Alzheimer's disease. The goal for Alzheimer's drug therapy is to maintain cognitive function, that is thinking and memory, and alertness for as long as possible. Drugs are used for mild symptoms, early disease progression, and drugs doesn't work once severe memory and functional loss happen. And drugs inhibits enzymes that breaks down the acetylcholine. Acetylcholine is an important neurotransmitter for memory. People with Alzheimer's disease, they will have lower levels of acetylcholine. Usually, acetylcholine is breakdown by an enzyme named choline esterase. If their action is inhibited by Alzheimer's disease drug, then more acetylcholine is available for communication between the brain cells. And next we are going to see about drugs. They are subdivided into three categories, that is antidepressants, benzodiazepines and antipsychotic. Antidepressants are used for depression problems and benzodiazepines are used for anxiety and sleep problems and antipsychotic drugs are used to treat hallucination. And next we are going to see about the drug Tacrine. It is used to treat symptoms from mild to severe. It is the first centrally acting choline esterase inhibitor which has been approved for the treatment. It improves thinking ability in patients and it is broken down in liver by cytochrome P450 symptom. And last, we are going to see about the drug named donepezil. It is used to treat confusion related to Alzheimer's disease. This improves memory awareness and the ability to function. It interacts with NSAIDs, theophylline, and nicotine, and thus the reason it is contraindicated in cardiac and liver problem patients. And some of the common side effects of Tacrine and donepezil are nausea, vomiting, confusion, rash, weight loss, loss of appetite, and agitation. Thank you.